Good morning, everyone. In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. The WHO has declared the coronavirus disease 2019 as a pandemic. A global coordinated effort is needed to stop the further spread of the virus. I am Smriti S., second year MSc Nursing student of Sri Gokulam Nursing College, and in this presentation, we will take a quick look on PPE, that is personal protective equipment, COVID management in ICU, COVID management in obstetrics, COVID management in pediatrics, treatment protocol, and nutritional interventions and need of rehabilitations. First, we can move to the donning and doffing of personal protective equipments. Personal protective equipment is defined as the protective clothing, helmets, goggles, or other garments or equipments designed to protect the wearer's body from injury or infection. So, these are the personal protective equipments which include N95 respirator, gloves, gown, goggles or face shield, and food covers. The donning refers to putting on work clothes and doffing refers to taking off work clothes. First, we can move to donning. According to CDC protocol, before starting the donning process, change into clean surgical scrubs or provided disposable garments and washable footwear. No personal items such as jewelry, watches, cell phones, or pens should be brought into the patient's room. Ensure hair is pulled back away from the face and of the neck and back. The step 1 of donning is inspect PPE. That is, visually inspect the PPE to ensure that it is in serviceable condition and that all personal protective equipments and supplies are available and the sizes selected are correct to the healthcare provider. Step 2 is perform hand hygiene. Make sure to do hand hygiene in between your fingers, back of your hands and palms and wrist. Step 3 is put on boot covers. Make sure that the whole foot is covered. Wrap the strap for comfortable fit. Try not to touch the floor or other areas with your hands while putting the boot covers on. If you do, disinfect your hands before you put in your PPE on. Step 4 is put on inner gloves. Do it as you normally would. It is not needed to be done in sterile fashion. Make sure that the cuffs of the gloves go as far as of your arm as possible. Step 5 is put on gown or coverall. Ensure that the gown is sized properly and large enough to allow unrestricted freedom of movement. Start from the legs and reach the shoulders. Remember to zip on completely upon the neck. Ensure that the cuffs of inner gloves are tucked under the sleeves of the gown and make sure that there is no gap between the gloves and the sleeves to prevent potential skin exposure. Step 6 is put on N95 respirator. Place the N95 respirator on your face, covering the nose and mouth. Strap it behind your head below ears. Step 7 is put on surgical hood. Make sure all parts are covered and extends to the shoulder. Step 8 is put on outer apron. Outer apron provides an additional layer of protection from the exposure of body fluids from patients. Step 9 is put on outer gloves. Double gloving provides an extra layer of safety during direct patient contact and during doffing, that is, taking off PPE. Step 10 is put on face shield or goggles. Face shield provides protection on face. Let the foam rest on your forehead. Make sure it covers the front and sides of your face and no areas are left uncovered. Step 11 is verify. Ensure all parts of the skin are covered and is able to move comfortably. So this is all about donning, and now we can move to doffing. Before you move from the patient's room and into the doffing area, you will need to take a few minutes to inspect your PPE for visible contamination, cuts or tears. If so, disinfect the surface with an EPA designated disinfectant wipe and disinfect outer glove. Step 1 in doffing is remove outer apron. Remove the apron by breaking the strap or lifting the strap over your head. Roll from inside to outside and away from body. Discard it in the appropriate receptacle. Step 2 is disinfect outer gloves. Step 3 is remove boot covers. In Doffing area, you will have two chairs. One will be where you sit to take off your boot covers only. This chair will be marked clearly as dirty. Once you sit down, be careful not to touch one leg with the other. Grasp the outside of the boot cover and pull it off your foot and dispose it in the appropriate receptacle. Step 4 is disinfect outer glove again. Step 5 is discard outer glove. There are 2 points to remember. Don't contaminate your inner glove and don't stamp the gloves which would cause spray. Dispose of the outer gloves and inspect the inner gloves for visible tears or contamination. This is how you should be removing your glove. Step 6 is remove inner gloves. Once the inner gloves are off, perform hand hygiene with alcohol-based hand rub. And the next step is put on a new pair of gloves up to the edge of the sleeve and disinfect the new pair of glove. Step 8 is remove face shield. For that, tilt your head forward, grab and pull it forward and over your head, which will let the face shield fall from your face. Dispose of in the appropriate receptacle. Step 9 is disinfect inner gloves. Step 10 is remove the hood. Grasp all the crown of the head and use one hand to pull the hood forward away from the body of the head. Step 11 is disinfect inner gloves. Step 12 is remove gown or coverall. This is a very important step. Tilt your head back and reach for the zipper at the top of the suit. Grasp the zipper with 2 fingers of one hand without using the other hand and unzip completely. An assistant will help you to unzip the cover if necessary. The assistant will stand behind you and grasp the outside of the coverall, all the shoulders and pull it off your body in a downward motion until the coverall is off your shoulders completely. The assistant will then reposition his or her hands and roll the suit outward and down the back in a controlled fashion, removing your arms and slowly pulling it down until it is at your waist. Get the coverall off the rest of the way. You may need to sit down in a clean chair, grab and pull it away from your body, one leg at a time. Dispose of it. Step 13 is disinfect inner gloves. Step 14 is discard the inner gloves. And step 15 is put on a new pair of gloves and disinfect it. Step 16 is remove N95 respirator. Tilt your head forward and use 2 hands to grasp bottom strap. Grasp the other strap, pull on the sides, then over your head. Dispose of it. Step 17 is disinfect inner glove. Step 18 is discard the inner glove. Step 19 is perform hand hygiene. And step 20 is exit doffing area. So this is all about donning and doffing of personal protective equipments. Hope you all have understood. Thank you.